the reason that we voted to expand Medicaid in Maine was because our legislature between 2013 and 2015 had passed Medicaid expansion with bipartisan support, but unfortunately they were unable to secure the votes necessary to override Governor LePage's veto. So he vetoed it 5 times. The legislature had approved it, but we came up short in terms of override. So luckily in Maine, when that kind of situation happens and there's a perception maybe that lawmakers aren't respecting what people's wishes are or maybe what's in the best interest of the state, we have the opportunity through the ballot to put an issue like that on the ballot, and that's exactly what we did. Last year in 2016, we were able to collect about 66,000 signatures, which is what was needed to put it on the ballot in almost a day, and decided to go forward with this for Maine people and give them the chance to sort of weigh in on this issue. So in terms of what the expansion means for Maine people, it means a lot of things. You know, obviously it means that about 70,000 people are going to get health coverage, many of whom currently do not, many of whom are working people who didn't have access to affordable coverage before. It means that we will be drawing down the federal funds, $500 million a year, that will support economic activity in our state and contribute to the creation of about 6,000 jobs. And you know, it fundamentally means that Mainers have stood up and said, we believe there's a different path that we can take in this state, and it's one that recognizes the need for people to have access to health coverage that they are currently being denied as a result of the actions of the LePage administration, and that we want to sort of chart a different course. You know, one of the things that has happened under this administration, back in 2011, they rolled back coverage for working parents and for other individuals, and not only did that mean then that tens of thousands of people lost access to coverage who previously had it, but in the case of working parents, one of the things we know from the data is that when a parent loses access to health coverage, their children do as well. And so we had about 5,000 kids who lost coverage. Maine was one of the few states that after the implementation of the Affordable Care Act, we actually saw fewer children with health coverage than more. And similarly, we were one of the few states that saw very little improvement in terms of the number of people who had access to coverage. So, you know, this initiative effectively sort of helps to put us back in the right spot. It also allows us to assure that people have access to the preventive care they need to better manage their health conditions. So again, one of the things we've seen in Maine is in America's health rankings, we went from being ranked around 8th nationally in 2010 to by 2015 dropping down to about 22nd, which is the lowest we've been in 25 years in that ranking. So, you know, denying access to health coverage has consequences on people's health and economy, and this is, again, a chance to have addressed that. So we're excited about that, and certainly excited for what it means for low-income people and what it means for Maine in our economy. So the proposed tax plan has a lot of things in it that are not good for low and moderate income Mainers. You know, one way we look at this is we think about if you were going to do something for $1.5 trillion, what are things that you could do that actually would make a difference in the lives of low and middle income people? And it turns out that giving outsized tax breaks to foreign investors and wealthy corporations and wealthy individuals is probably not in their interest. You know, it turns out with that price tag, you could double the Pell Grant. You could do a whole host of other things that, you know, individuals and small businesses alike really recognize are what make a difference for them and their communities. You know, there are specific provisions that are continuing to be refined and developed. In the case of the Senate plan, you know, there's the elimination of the individual mandate, which our analysis indicates that roughly 50,000 people will lose access to health coverage, and that many people will see their health insurance costs go up anywhere from, you know, $800 a year to $3,000 a year. Particularly hard hit will be people who live in rural parts of the state. And I think Senator Collins herself made the point that that provision alone for many low and middle income families will undo any of the benefits that they might have gotten through the tax cuts themselves. You know, the other side of this is how these tax cuts trigger future cuts in programs and services that people throughout the country rely on. And so when we consider the potential implications on whether it's Medicaid or Medicare or supplemental nutrition assistance programs or a whole host of other programs, that reducing resources available for those programs ultimately will fall on the backs of those same individuals and families who are receiving modest, if any, benefit from the actual tax cuts themselves. And then I think the third part of this is what it ultimately means in terms of the state budget and how states have to respond to compensate for a lack of resources from the federal level. And in many states, and certainly we've seen this in Maine, those costs tend to trickle down through property taxes and through other regressive forms of taxes, which again sort of washes out any benefit those individuals and families on the, might receive from federal tax cuts. So, you know, I think there's still a lot of moving parts. We're certainly grateful for the leadership of Senator Collins and Senator King in some of the fights that have occurred to date, and we certainly hope that they will continue to stand strong for Maine people and represent what's not only in the best interest of their constituents, but also what's in the best interest of all of us as Americans. Well, I think it's an interesting question about Maine being a purple state and how our parties work together in the state to address issues that people face. I think, you know, there's a reality that most of us who work in legislative process recognize, which is that there's a lot that happens that actually there is agreement. You know, I'll give an example. We just passed another ballot initiative to change the state's constitution to increase the period of time over which the pension system can recoup losses that occur as a result of market downturns. And when that proposal came before the legislature, it got unanimous support from our state senate. So bipartisan, you know, independent support was with it. So there's a lot of work that gets done that's not getting the headlines and is not as contentious. But there are some fundamental differences where that ideology or divide sort of rears its ugly head. And certainly the fight over Medicaid expansion was one of those. And I think I couldn't pretend to represent that in Maine we have some great collegial environment that you don't see in other states that allows us to get things done, because in truth we didn't have that as it related to Medicaid expansion, and so that's why we took it to the ballot. So I think the way we get things done at some level is reminding lawmakers who they ultimately work for and making sure that voters have a choice not only in who they elect, but also in the policies that, in giving voice to the policies that matter to them. And so, you know, hopefully both this initiative and previous initiatives that we passed in 2016 help lawmakers understand more clearly what they can do to represent the interest of their constituencies and the interest of the state.